Hello. Hi. Hi guys, how are you? Mkofiti. Welcome to another Mommy Daughter Conversation featuring my co-star
Miss Mombos.
Yes, mimi ndio starring, wewe ndio co-star. Hiyo co-star. Unacheza hapo saba. Yeah, and you're back again with another interesting conversation. And today I am very excited. Mombos, are you excited?
We are very excited.
Yes, because the conversation today is lit. Guy, hata sijaitumia hiyo word in a conversation anywhere with anybody. Our conversation today is going to be very interesting, and I want to start with by giving you a small backstory. My first encounter with a gynecologist was when I got pregnant with you.
Me, guys.
Yes, and I was 23 years old. And the truth is, actually, when I went to the hospital, I was 3 months pregnant when I went to the hospital for my first visit. Na nikienda hospitali, I was not going to see a gyna. Sikuwa nimesema ati naenda juu nimekuja hapa kuona gynecologist. Me, I was just going to the hospital to see a doctor. Because when you're pregnant, you have to go see a doctor. And I remember at the reception, the lady was asking me a few questions here and there, the reason for my visit, and that's when I mentioned I'm here because I'm pregnant, so I want to see a doctor. Oh, okay, you're going to see our in-house gynecologist. His name is Doctor. He was a doctor. I can't remember his name. And yes, that was my first time ever having conversation with a gynecologist. And I remember kwa hiyo ofisi, he was asking me a lot of questions. And the answers to those questions was, sijui, no, I don't know, no. Because for sure, that was, as in sikuwa nimeongea na gynecologist ever, hata nimeenda kuona ati a gyna in a hospital. Yes, and I remember, I think the last question aliniuliza was, so is this your first time ever seeing a gynecologist? And I was like, yes. And anyway, that was my first time. Wacha niache story mingi. Yes. And hiyo ni Mwakenya nimewapatia. Because we have a guest on set today. It's not just us. Yes, Mumbos.
Yes.
We have a guest. And karibu sana.
Thank you so much.
Dr.
Oh my God.
Karibu, Dr. Karen.
Thank you.
Yes.
Thank you.
So this is how we're going to do it. I will allow you to introduce yourself, and then we will continue the conversation.
Thank you so much. I'm very excited because we rarely have these kind of conversations with mom and daughter at the same time, you know. Yes, so my name is Dr. Karen Muthembwa. I'm a resident in obstetrics and gynecology. My passion is basically to actually just teach people about gynecology, reproductive health, and particularly teenagers. Yes, and I love working with women.
So, Nona, today we have the perfect guest for our conversation. Thank you so much, Dr. Karen, for honoring our invite.
Thank you.
We are very excited. We can't wait to start this conversation.
Me too.
And let's just get straight into it.
Yes.
Me have a question, my first question. And the first question is, so when is the right time for our girls, and in this case, Mumbos, to start seeing a gynecologist?
Wow, that's a very nice question because rarely do people ask themselves, when should I see a gyna? Instead, they go and see a gyna when there's a problem. Or when
I got pregnant.
Yes.
Yes.
That's a good thing, but it's a thing that took you to the gynecologist.
Yeah.
But these days, we like to catch things early. We like to educate. We love to be able to have conversations with ladies earlier on before anything happens, and especially things like pregnancy and all these things. So there are two things that I would look at before you can start seeing a gynecologist. And the first thing is the age. Yeah, your age. There's an age factor we look at, and the best time to see a gynecologist will be any time a girl starts to develop, and most of us will develop from 11 onwards.
Yeah.
You know, we put a cutoff of that from 13 years old, but by the time someone is 13, they've already started changing. So we want to catch these things earlier. So I would recommend that they start as early as 11 years old, when they can kind of understand a little bit about their bodies, and they can even ask questions to the doctor, even themselves, not just mommy or daddy asking questions. The other thing I would consider is if there's any issue with a child, particularly a girl, before 11 years of age. You've had those ones who started puberty early?
Yes.
7 years, 6 years, even 3 years.
What?
Yes, surprisingly, there are people with conditions, that can lead them to developing a bit earlier, or they have even abnormalities with their reproductive system. So they don't have a cutoff of age. They might need to start seeing a gyna from the beginning, or even those ones who've been affected by abuse. You've heard of people who've been sexually abused. Children being defiled. Those ones might actually start seeing a gynecologist early. So there is not really like a time that's perfect for one person, but it depends on certain things. But age-wise, if you reach 11, come see me.
So we're having this conversation at the right time. Because Miss Mumbu's here just turned. Okay.
I have a swali.
You have a swali already?
Yes.
No, you start by saying your age.
Okay, guys. So I am turning.
You're turning.
I am turning 13 years.
Next year, Mumbus.
You're a preteen.
Yeah, no,
Okay.
She's 12 now.
Shocker.
Congratulations.
So I have a question.
Yes.
So me being slightly older than 11, should I have already talked or met with a gynecologist?
You see, now you're 12. It means there's no too late to see a gynecologist. So it's still a good time to start seeing your gyna. Remember, for you, you're actually starting at a good time because it's anything above 11. So if you're 13 and you're watching this right now, then you need to see a gyna. So in the perfect age group to actually see me.
Perfect.
Or any other doctor, but a gynecologist, particularly about your reproductive health. Yeah.
Oh, nice.
So you haven't gone yet?
No.
Not yet.
Yes.
Okay. It's
You
good
haven't
time.
been to
It's
see
good
a
time.
gynecologist.
Oh, yeah,
Yeah.
I haven't.
Yes,
You're in
but
good
definitely
time.
after this conversation, we're going to see Dr. Kyle.
You're
You're
welcome.
making an appointment right after this conversation.
Yeah.
Good. So what does this first visit look like? What's the conversation that you're having with her during this at the very first visit?
Okay, so when a girl comes in when they're very young, preferably that 11 years, sometimes they can come in at 10, 9, because you remember there's also the vaccine that we do give young girls from the age of 9, and parents will tend to take their baby girls. I'll say baby girls because they're still baby girls.
Yes.
To either a gynecologist or a general doctor who'll be able to give them a vaccine. At this point now, we are assuming everything is okay, that you're just starting to develop. Developing, it means now you're changing from a girl to a woman,
Yes.
and that is called puberty or adolescence, which is a very, very nice period. I really like it because I think there's some changes that when you're young, you look at your mom and you're like, I want to be like this. I'm gonna look, I don't know whether she ever tried to wear bras when, because did she do that?
She did.
To wear a bra before the time you should be wearing one.
Yes.
Yes.
Oh,
no.
that she did. Yes.
Don't worry, I did it. I did it too. I did it. That's how I know that you probably did it. But yes, like you're always looking forward to growing into this nice, grown-up woman with hips, you have breasts growing, hair growing in different areas, then smoother skin, although there are people who develop pimples.
Yeah.
So now when we can be able to have this conversation, we start with you. When you come to my office, like now I should talk to Mumbus. When you come to my office, first of all, we'll be like, I'll introduce myself, then you introduce yourself, tell me your age. At this point, I can be able to tell even how you walk, I can tell that there's a change in gait, there's maybe like I can see there's some developments going on. In case they haven't started, then I would even probably have an examination. I would take the normal blood pressure, check your weight, check your blood sugar, because some people with diabetes and other conditions might not develop as fast as other people. Mm-hmm. So that can develop, can reduce, that probability of good progression in terms of your health. So we check on such things, baseline tests. Uh-huh. Then we also we examine you. We look at your face, we look at the skin. skin. Sometimes it can tell us whether someone is probably going to develop things like PCOS at a later age. You've heard of something called polycystic ovarian,
Yes,
which is
PCOS.
usually diagnosed around 18, 19, 16 years old because it starts developing from early. So if you can be able to pick out even family history from just that first visit, like you'll tell me, oh, maybe my mother had this, or maybe had hair on the chin when it's not supposed to be there. It can also be familial. It may not be a disease. So we pick out things like that. When I examine you, I'll examine things like I'll look at the chest area, see whether there's any development, whether it's okay, whether it's normal, whether there's an abnormality with the breast. It can happen. Then we also look at the abdomen. Sometimes some babies, even young children, can have things like an extended abdomen, which contains maybe things like cysts, maybe an abnormality with the reproductive organs, things like that. Even the hair distribution around the pubic area, we're able to tell this is at what stage of development. It's interesting, right? That's very interesting. Yeah, I can look at someone and you can stage, we're at stage this, which kind of helps us to know, okay, we are doing well, then let's continue, and then we give you another visit. Another visit depending on whether you're okay or not. So if you're fine, then we can say, okay, let's see you again in the next couple of years, maybe when in the next 5 years, or when you're 21, or depending on what. If you haven't started your period, we might say, okay, once you start your period, then we can come by, we review you again, and then see how things are doing. If not, if you've already on your period and everything is okay, then we advise you on some of the things that you should look out for. Things like pain, pain is not supposed to be normal, right?
Yeah.
It's not normal to have pain, but it can happen during your period that you have mild to moderate pain. If the pain is too much, that's when you can come back to us as doctors so that we can be able to review you and see whether there's anything we need to check out. Another thing is if you're bleeding too much. There's also a bleeding that's not acceptable when you also can't do your normal daily activities. You're changing a pad every single hour, or a tampon, or whatever it is that you're using, then that's too much bleeding. If you're even seated somewhere, you've just worn your pad and you're wetting yourself, then that's also not normal. So we give you advice on what to expect, what is abnormal and what is normal. Yeah.
Miss Mumbus, has yours been normal?
Yeah. I mean, it's none of anything that she had said, but it is normal.
It is normal period. Okay.
Yes.
All right. Do you have a question?
Actually, yes. So this is a very specific question. So I'm aware that when I go to the gyno's office, there's a lot to expect. Like, you're going to have me take off my clothes. I'm going to examine different parts of my bodies. But there's one small thing specifically that has been on my mind ever since Mom introduced this topic. Is there, like, at any point, are you going to have to, like, inject somewhere down there for some test or something like that?
The funny thing is, most people are afraid to go to the gynecologist for the first time. There's no injection, absolutely no injection. Especially for young girls, teenagers, there's no need for an injection. But I can tell you for sure there are times if you're older and you need some other treatment to be done, there could be an injection for different reasons. For different reasons, which are many, but not for you.
Not on the first visit.
On your first visit, surely we can't be traumatizing you like that. But yes, we do examine you from head to toe. We don't expose every part of your body. First of all, you can decide if you want to have your mom there or not, because it's your body, right? So you can just remain with the doctor. Most people will prefer female doctors for young girls, but in case that you do have a male doctor, you can ask for a chaperone, or your mom can stay there. So you shouldn't be afraid to go there. You shouldn't be afraid that you're going to be only with a man in a room alone. No. And they're trained. They're really trained. They're gynecologists. So most of us who work like this, we're very professional about it. And we'll offer that. We'll ask you, would you like to have your mom here with us? Or do you want a nurse or any other lady doctor to be there with you? So yes, we expose you, but we don't expose every part of your body. If I'm examining just here, every other part will be closed. Yeah. So you'll not just be there. And then if I'm examining down there, there'll be no instrumentation, because there's no need for instrumentation unless we're dealing with a reasonable thing. That's the only time we instrument. But any other time, we just examine the outside, nothing more.
No injection down there.
No injection down there. And you shouldn't be afraid, because, sometimes we are taught that a woman should be like this, should be like this, should be like this. Now you're afraid to go to the doctor because they'll look at a place that is private, a place that you've been taught maybe it's shameful, unfortunately, in our society, which is not. It's a part of our body, and it's normal, and it's supposed to be the way it is. So don't be afraid.
Wow. Okay, so let's just, I have a question for you. Okay. On this first visit, because we are booking an appointment right after this conversation, am I allowed in the room or am I not?
Okay, so I feel like you should be, because you've seen every crevice of my body.
I have, that's for sure. I have.
Yeah. So I don't feel like it will be anything new.
Thank you.
Yeah. Yes. And I'm glad because she's comfortable with you. There are people who are not with their mothers as well. Or maybe they came with their dads. Because there are people who have single dads, or maybe the mother is not around, maybe she traveled, and the only way you can go to the hospital is with your dad. So most of the time, if your dad may not be able to stay there, so that's when you can ask for a chaperone. Hopefully you have a lady doctor, then that also is a bit more comfortable for you. But yeah, this relationship with your parents is very, very important.
Good. So I have another question. So we are talking about the importance of going to see a gyna from when they're very young. But how do we go about identifying a good gynecologist? Like what's that process? Juu najua kuna wazazi pale wanasema okay, but sasa huyo gyna tunamtafuta wapi?
Well, we are many, by the way. Not enough for the whole country, I can say that for sure. But there are different ways you can get to know a gyna is around. So one of the ways is, let's say mom saw a gyna and they want to introduce their daughter to her own gynecologist. Okay. If they've ever, of course, they most likely have seen a gynecologist, as long as they've delivered. The other way is word of mouth. Maybe someone told me this gyna is good with young girls. Then you'll be like, okay, let me take this gyna to this one. The other way is to walk into a hospital. Any big hospital should have a gynecologist. So they will tell you that we have this number of gynecologists. They give you a list, and then you can have a look at their faces, and then you choose. Yes, it's very easy. And then again, these days we're also on social media. Yes, we are on social media. Sometimes you can watch what we talk about. There are many of us actually, several of us. I think we're like around 4 or 5 who talk about gynecology. So you can look at the videos, learn something. Maybe they've talked about something you want to talk about. That's another way of picking a gyna. Other people choose female over male. Others decide I want a male over a female.
Okay, that's very clear.
And sometimes we even refer each other. We refer to each other. So let's say if I feel like I don't do abnormalities of reproductive health, I send it to one who does that. Or if I do obstetrics, so obstetrics is pregnancy only, and I know someone who does gynecology only, then I send them to that doctor.
Okay. All right. Thank you so much, Dr. Karen, Dr. K. That was a very interesting conversation. We are ready to make that up. Actually, tukisema tu cut. we are making that appointment. Yes, Mumbus?
Yes.
Yeah, we need to come see you and start our journey. We are very excited about that one. And yes, if you would like to talk to Dr. Karen, I'm going to leave her information here, somewhere here. Yeah, please feel free to reach out to her. Alafu, kama kuna maswali, because this is just the beginning of this conversation. Please, Dr. Karen, be ready. We would like to have you here for many more conversations, because I feel like this is just the beginning.
Yes.
When it comes to reproductive health, there's a lot that you can talk about. Yes, and you're looking forward. Me, I am very excited. I'm looking forward to having you here again.
Me too. Very happy. Thank you.
So guys, if you have any questions, or if there are any specific topics that you'd like us to talk about with Dr. Karen, please tuachie hapo kwa comment hapo, and then we will make sure we've invited Dr. K again here. Mumbus, do you want to close for us? You want to wrap it up?
Thanks for watching. Bye.
Okay, thank you guys. Until next time.
Bye.
Bye. Bye.
Bye.
Bye.